come in?
Hi, Mr. Gonzalez. My name is Yvette, performing hand hygiene. I'm going to be your nurse today. I'm here to do a head-to-toe assessment. Is that okay?
Yes.
Okay, before we begin, I'm going to go ahead and have you verify your first and last name and your date of birth for me.
Julio Gonzalez, 04/20/1991.
Perfect. Do you know where you are, Mr. Gonzalez?
In a hospital room.
Okay. And do you know why you're here?
For an assessment.
Perfect. Could you tell me the president?
Donald Trump.
Oh, okay. And could you tell me what year it is?
2020.
Perfect. So that's part of the general appearance of the assessment, and I was assessing for level of consciousness as well as cognitive functioning. Also assessing skin color and speech and communication. Now moving on, in order to test for cranial nerve number 2, I would do the visual acuity test with the Snellen chart. And the Snellen chart is, I would have him stand 20 feet away from the chart, and he would be reading the line that it was clearest to him. Now I would go ahead and also figure out the BMI for the patient. Mr. Gonzalez, could you tell me how tall you are?
5'6".
And you can pick whatever weight.
170.
Okay, and the BMI is 27, which is in the healthy section of the chart. Now moving on, I would also get the vital signs for the patient, including the heart rate, respiratory rate, blood pressure, and body temperature. Now moving on to the head and face portion of the exam, I would go ahead and inspect shape of the head, as well as inspect and palpate scalp and hair. So I would go ahead and inspect and palpate hair and palpate the scalp here for any lesions or any infestations. Now moving on to test for cranial nerve number 7 for the facial symmetry, I would look at the eyebrows, the eyelids, and the nasolabial folds as well. Now I'm going to go ahead and palpate the sinuses, the maxillary sinuses and the frontal sinuses. Should feel firm but no pain, as well as palpating the temporomandibular joint. Could you open and close your mouth for me? Good, close, and then move your jaw side to side. Perfect. That's for testing for inspecting and palpating for crepitation. Now moving on to the eyes, we're going to go ahead and test cranial nerves 3, 4, and 6 by performing the 6 cardinal directions of gaze, as well as the pupillary light reflex. You could go ahead and look at the top of my pen here, and follow it only by moving your eyes and not your head. And then that's testing for accommodation. And now the pupillary light reflex here. Good. Good. And when testing pupillary light reflex, you would state PERLA, pupils equal round reactive to light and accommodation. Now if you could go ahead and look up for me, and then inspecting the conjunctiva and sclera. Now moving on to the ears portion of the assessment here, and I'm inspecting the external skin condition and also palpating the pinna and around the ear for any bumps or skin or any deformities here, and then also inspecting the auditory meatus for any cerumen. And now to test cranial nerve number 8, if it's intact, is by performing the whisper test. I'm going to whisper something on each side, and he's going to repeat it. Red carpet.
Red carpet.
Black shorts.
Black shorts.
Perfect. Now moving on to the nose. I'm going to inspect and palpate the nose for any deformities or any bumps or anything like that. And then I'm going to go ahead and test nair patency by, if you could press down on one side of your nose and breathe in through the other. And then do the same thing on the other side for me. Now moving on to the mouth and throat. I'm going to inspect the lips for color, buccal mucosa, teeth, gums, the tonsils, the uvula, the palate, the floor of the mouth as well. So if you could go ahead and open your mouth for me, Mr. Gonzalez. Like this. Expecting tongue. Lift your tongue up for me. Buccal mucosa, teeth, gums, floor, as well as soft and hard palate here. Perfect. And then could you say ah for me? That's testing cranial nerve 9 and 10. And then could you go ahead and stick out your tongue for me to see if it's midline? And that's testing cranial nerve number 11. Thank you. And just making sure. And now we can go ahead and move on to the neck portion of the assessment, which would be, first I'd go ahead and inspect the glands. So I would inspect the parotid, salivary, and the thyroid glands to see if they are enlarged. Then I would go ahead and palpate the lymph nodes. So preauricular, postauricular, jugulodigastric, submandibular, mental, superficial cervical, deep cervical chain, occipital, posterior cervical, and then if you could shrug up for me, supraclavicular lymph nodes. Now I'm going to go ahead and test range of motion of the neck. So if you could extend your neck back for me and then touch your chin to your chest for me. And then turn your head side to side. And then touch each ear to each shoulder for me. Perfect. And then I'm going to test cranial nerve number 12. If you could push up against my hands. Perfect. And that is how you test the neck portion. And now moving on to the further part of the neck assessment is I'm going to palpate the carotid here on both sides. Then I'm going to listen with the bell of my stethoscope to the carotid. If you could go ahead and when I palpate, breathe in and out, and then hold your breath on breathing out. Go ahead. Hold. Good. Now the other one. Perfect. Now, before we move on, I'm going to go ahead and, in order for me to assess to see if jugular vein distension, I would have the patient's head of the bed lowered to 30 to 45 degrees, have the patient look the opposite direction, and then you'd be able to see if the vein is flat, and if you look this way, you'd be able to see if the vein is flat or distended and bulging. Now moving on to the upper extremities, I'm going to go ahead and start off by saying that I would inspect skin color of the upper extremities and characteristics for skin conditions as well as lesions. And then I'm also inspecting, if you go out like this, also inspecting skin temperature. Good. And then I'm going to go ahead and inspect radial pulses on both sides at the same time here. Now assessing range of motion. So if you could hold your arms out for me. Okay, 10 seconds. Now if you could fold your elbows here. Rotate your shoulders for me. Good. Move your wrists around. Circles. And then just go like this. Good. Close and open your fingers for me. Spread your fingers. Perfect. Now we're going to go ahead and assess strength here. So if you could squeeze my fingers, please. One more time. Good. And now if you could go like this for me and pull towards you and push. Oh, no, push against with this. good. Pull, and then push, perfect. Now, moving on to the chest, and for that I would go ahead and inspect anteriorly and posteriorly, anteriorly skin, just to see if there's any deformities or freckles or moles or lesions on the anterior, and then posterior as well, checking for the same thing, if any lesions, moles, or freckles. Now I'm going to go ahead and auscultate anteriorly to breath sounds with the diaphragm of my stethoscope, and then just take deep breaths in and out. It's okay. Now we'll listen to 5 different areas in the front, anteriorly on both sides. Now moving on to posterior, listening to 9 different areas on both sides. And then on the right side, if you could lift up your arm for me, we listen to 3 different areas here. And then on the left side, we're going to go ahead and listen to 2 different areas. Perfect. And right here, towards the upper portion of the chest would be bronchial breath sounds. Middle portion would be bronchiovesicular, and lower to the apex of the lungs would be vesicular breath sounds. Now, moving on to the heart, we'll go ahead and auscultate the apical heart rate. And assess rhythm as well. Now I'm going to go ahead and assess and auscultate the aortic, pulmonic, mitral, and tricuspid areas. First with the diaphragm. Mitral and tricuspid. And now with the bell of my stethoscope, aortic, pulmonic, mitral, and tricuspid. Now we could go ahead and move on to the abdomen portion of the assessment. And first I would, if you could scoot up a little bit closer to the edge of the seat for me, Mr. Gonzalez.
I'm sorry?
If you could move up a little bit closer to the seat. Shift your bottom a little towards the front of the seat. Just scoot up a little. Yeah, thank you. Lean back for me. And then for the abdomen assessment, I would go ahead and assess contour and symmetry of the abdomen at eye level. Now before I begin to palpate, I auscultate first. I'm going to go ahead and auscultate in the 4 different quadrants with the diaphragm of my stethoscope. Listening for bowel sounds in each quadrant. And then with the bell of my stethoscope, I will be listening to the aorta, and then as well as the renal arteries. Aorta to about 2 inches above the umbilicus. And then the renal arteries about 2 inches to the right and left of the aorta. Now that auscultation is done, we will go ahead and lightly palpate first and then deeply palpate. lightly palpate. Any tenderness or any pain all over the abdomen here. And then now deep palpation, which is deeper, and checking for any bumps, any further pain all over the abdomen here. Okay, there we go. Now moving on to the lower extremities. You can go ahead and put your feet up for me, Mr. Gonzalez. So in order for the lower extremities, I would also assess skin color of the lower extremities, as well as assessing if there's any lesions or anything on the lower extremities. Also assessing skin temperature here. And now that I'm at the bottom where his feet are, I will go ahead and palpate for the dorsalis pedis and note rate and rhythm. And testing for capillary refill as well. Good. This is good. And then now I'm going to go ahead and test for range of motion and muscle strength as well. Before I do that, I will go ahead and assess for pretibial edema. Okay, Mr. Gonzalez, if you can pull my hands towards you, good. Push against them, good. If you can move your ankles for me, flex and, yes, good. Your toes. Now if you could bend your knees for me. Perfect. Now, okay, good. Now moving on, I'm gonna go ahead and actually test capillary refill on the hands.
Bless you.
Thank you. And actually I'm gonna go ahead and test profile, excuse me, profile sign as well on the fingernails. Now, Mr. Gonzalez, I'm gonna go ahead and do the sensory neurological portion of the assessment. I have a cotton swab, which is the light sensory touch test. I'm gonna go ahead and touch different areas of your body and with your eyes closed, and you're gonna say now when you feel it, okay?
No. 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 No.
Perfect. Now we're gonna go ahead and do the sharp and dull touch. If you could give me your hand. This is sharp, this is dull, okay?
Okay.
Close your eyes for me.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Sharp.
Perfect. Now we're gonna go ahead and test cerebellar function. So touch your finger to your nose and onto my finger as fast as you can. Perfect. Now also testing cerebellar function is if you could go ahead and slide your heel all the way up your shin for me. Perfect. I'm going to go ahead and ask you to put your feet up so I can test for Babinski reflex along the side of the foot and across, along the side of the foot and across. And then now I'm going to go ahead and test the quadriceps and the biceps reflex using the diaphragm of my stethoscope. You could sit all the way back into your chair and let your knee hang like this. And then I feel tendon and go ahead and hit here. And you should see a slight reflex on there. Now if you could make a muscle for me, Mr. Gonzalez, and feeling the biceps tendon, will it loosen up a little? Thank you. And then There we go. You should see a reflex as well with the biceps. Now, Mr. Gonzalez, if you could go ahead and stand up for me. And turn around for me this way. There we go. If you could go ahead and, actually, sorry about that. We're gonna turn you around the other way. You can go ahead and walk to the end, and I'm just assessing his gait. And then on your way back, if you could touch your heel to toe all the way back. Good. And last test I will be performing right now for the reflex test is the Romberg's test. You could close your eyes and put your feet and heels together, please. Good. That's assessing balance. Thank you, Mr. Gonzalez. If you could go ahead and turn around this way, we would be looking at, this way first. And we should be able to see that the thoracic portion of the spine is concave and the lumbar portion of the spine is convex. And last but not least, we would look at the straightness of the spine. And in order to assess that, I would ask Mr. Gonzalez if you could touch your toes for me, please. There we go. Okay, and you can stand up, Mr. Gonzalez. Turn around for me. And that is the end of a head-to-toe assessment.